You were talking about how we should lower, like rent prices for middle class families as well. But majority of housing, right? It's like owned privately. How would you regulate private pricing, like for rent?
It's a great question. I think number one, I do think that the market does a pretty good job of that. When you have it, the reason that housing prices can go up is when you don't have enough supply. And you just have this game of musical chairs, and the people that have the most money can rent the chairs. And number two, we do need more affordable housing. And one used to create more in the state through the old redevelopment agencies, which was a tax credit that they would give to cities in blighted areas. And during the last recession in about 2010, 2011, before I was in the legislature, when I was in local government, the state of California got rid of redevelopment completely because they wanted to capture those funds for their budget at the time. And that was a huge amount of the money that went to creating affordable housing in the state of California. And we haven't come up yet with a mechanism to create more of that subsidized affordable housing that is supported by the state and financially supported by the state, and where the rents are capped because it's public housing. And there's a lot of other things that we're looking at now, like social housing, which is a European model where people in the building who have more money help to subsidize units for lesser well-incomed individuals. So there are a lot of different schemes that are used around the world, but we don't always allow them in this country. So I think we need to experiment with a lot more of these.
Yeah. Okay, so as we all know, healthcare is extremely unaffordable for many Americans, right?
Right.
So if you are elected as Congresswoman, how would you resolve that issue?
Well, I've been an author of 2 single-payer bills in the legislature, and I do believe that we should move towards a government system of healthcare delivery. We have a broken system, and like you said, even in California, where we have Covered for California, and we've lowered the ceiling for getting subsidies, so more and more middle-class people now can get subsidies through Covered California, and we have almost 98% coverage in California. Because of Covered California, the premiums are still very high for people. And there are states that, because they haven't done the Medicare expansion, and they haven't taken advantage of Covered California because they're red states, and they just don't give people that access, where we have tens of thousands, millions of people who have no health care at all. And that puts a huge burden on the whole healthcare system. It makes that population very unsafe and unhealthy, which creates, again, more of a financial burden. It certainly robs people of opportunities of thriving if they can't have access to routine health care. And so this drags the entire economy down, and it's awful for people who don't have access to health care.
Right.
So we should have health care for everybody. I believe that the role of government is to keep people safe, right? That's the basic role of government. And people expect that if there's a fire, their fire department comes, that if there's a crime, the police department comes. But if you're deathly ill, and we're saying, well, that's on you, we're not keeping people safe. So a government-run system would be more efficient. It would put more of the resources into the doctor-patient relationship rather than the doctor-insurance company billing relationship. So more money into actual medical care, take the burden off of all of these practitioners from having to have entire billing departments and fight with insurance companies all the time, be a lot less stressful for individuals. And certainly tying your ability to get health care to your employment is really inhumane and doesn't give people the opportunity sometimes to take a chance on a new job or to leave a job and start their own business. That shouldn't come into the equation.